Hey there, this is Dave Hompes from Hpylorisymptoms.com. Another short video on H. pylori, this time answering the question, how do I know if I have H. pylori, or how do you know if you have H. pylori? Well, the reality of this situation is that you cannot possibly know whether you have H. pylori or not unless you run the appropriate testing. And here's why. H. pylori can cause a whole array of different symptoms in your digestive system. So things like heartburn, acid reflux, bloating, tummy pain, chest pain, bad breath, belching, burping, constipation, loose stools, diarrhea, and anything that relates to this kind of concept of irritable bowel syndrome. And you might think, well, if I have those symptoms, then surely I have H. pylori. But it's not so simple. The same symptoms can be caused by many other different factors. Some of those factors may be related to simple things to do with your lifestyle, such as the foods that you eat and whether you are chewing your food properly, whether you're eating in a calm and relaxed state and allowing your digestive system to work properly. Maybe related to having low levels of stomach acid and poor pancreatic function, which can also trigger similar symptoms as H. pylori. You may also find that you have parasites. There are little minuscule microscopic parasites like Giardia and Blastocystis and Cryptosporidium. And there are bigger parasites, some of the worms that we see when we run testing with people. You may have some Candida overgrowth or a similar yeast and fungal overgrowth in your gut. Or you might have something called small intestinal bacterial overgrowth, or SIBO for short, where you get a whole bunch of bacteria overgrowing in the wrong place in your intestine, and that creates a whole bunch of symptoms as well. In fact, we know for a fact that SIBO, just like H. pylori, can cause bloating, heartburn, acid reflux, and gastroesophageal reflux disease. So truthfully, the only way you can find out what's causing your symptoms is to eliminate potential foods that are triggering the problems, which may be things like gluten, cow's milk, soy, too much sugar. You need to get tested for H. pylori, but ideally you need to be tested for all these other things we're talking about as well, such as the parasites, such as the yeast and fungi, the small intestinal bacterial overgrowth, and your entire digestive function. Because you might find, even if you detect H. pylori, that the H. pylori is a little bit of a red herring. What does that mean? Well, it means that because the medical system kind of only really looks at H. pylori, it doesn't look at many of these other chronic digestive infections, you find the H. pylori when you run the test and you take the treatment and you feel no better. In fact, some people feel worse when they've had the treatment for H. pylori because it's other stuff that's actually causing the symptoms. So if you really want to figure out whether you have H. pylori or not, and in what context the H. pylori is sitting in regard to your general digestive function, you really need to go a little step further and look at the bigger picture. The medical system doesn't really look at these other functions and infections, and so if you'd like help with that, then please don't hesitate to look at my website. There's lots and lots of free information on there about how to test for H. pylori and all these other factors that I've been talking about, and I look forward to seeing you there very soon. My name is Dave Hompes, and I'll catch you later. Thank you.